This Sunday is not only Mother's Day, but the start of National Women's Health Week. Dr. Kelly Graziano, Medical Director with Optum Care Utah, joining me now with steps we as women can take for better health. And we want to take care of Mom. And no better care than making sure she is healthy and well.
Absolutely. This is perfect timing. Thanks so much for having me here to talk about women's health.
So how do we get started in making sure Mom is taken care of in terms of her health?
Absolutely. You know, I think the first step and really the cornerstone to the best preventive care is getting a relationship with a primary care doctor that you trust. So I encourage all women to go out, find a healthcare provider that they have a great relationship with, and then really checking in regularly for those annual wellness visits. Talking about immunizations, what tests may be indicated, also talking about, you know, education and looking at chronic illnesses and how to prevent them.
And that well-being check, you can go through so many things and things that might be brought up that you didn't think that was an issue and maybe something you have to investigate further.
Absolutely. You know, having that relationship and that level of trust, talking about what screenings may be indicated, having a doctor that knows your health history, all of those really lend themselves to great long-term preventive care. And that's what we want. We want to keep Mom healthy rather than treating her when she's sick.
Exactly, preventative. And there are so many screenings out there.
Absolutely.
It can get confusing. At what age, what stage? So
Yes.
do you have a list of when people and women should get checked up and for what?
Absolutely. So I agree, there's so much information coming at us from all sources, and how do we sort through that and know when we're due for these screenings? So some screenings that I like women to be aware of. First, cancers. So looking at breast cancer screening, mammography should start no earlier than age 40 but no later than age 50 for average risk.
Average risk, and if there is a family history, of course, you have to get checked earlier.
Yes, that's for average risk. Any family history definitely should be tailored, and that discussion you should have with your primary care provider. Absolutely. Cervical cancer screening should start at age 21. Colorectal cancer screening should start no later than age 50. So those are the big cancers we think about. Other screenings that you should take into consideration: if you're a sexually active woman, you should be getting screened for sexually transmitted infections at least annually. Also talking about contraception. If you're pregnant, making sure you're screened for gestational diabetes appropriately. Mental health is a big one that sometimes we don't have the opportunity to talk with our docs about.
You listed anxiety, and I love that you
Absolutely.
did that because it normalizes this is a condition that we
Absolutely.
can all face at
Absolutely.
some point.
We want to make sure that mental health is included in our overall well-being, for sure. So all adolescents and adult women should be talking about anxiety or depression symptoms.
And what's great is making sure maybe you have some already questions jotted down. For instance, you know, are there illnesses or diseases that are more at risk for women, and to make sure you bring it up with your doctor.
Absolutely. This is something I always try to educate my female patients about, is those risk factors that we have uniquely as women. So mental health, women are twice as more likely to have depression as men are. Osteoporosis, women don't have as much bone mass as men do, so we're predisposed to that. Cardiovascular disease, we sometimes have different symptoms when we're experiencing a heart attack or have heart disease. So being aware of those differences that are unique to women and really embracing them and talking to your primary care doc about them is what we recommend.
And healthy lifestyle, we say that over and over and
Yes.
over again, but it's a great reminder.
Absolutely. I can't emphasize how important a healthy lifestyle is. So there's a few things that you can do at any point in your life as a woman to incorporate into that healthy lifestyle. So as we talked about, getting a relationship with the primary care doc is super important. Maintaining a healthy weight, that has been a little challenging during COVID, but I think trying to take those steps for that healthy weight is crucial. Eating healthy, getting active and staying active, again, talking about your mental health, and then avoiding those unhealthy behaviors that we know lead to bad term effects. So avoiding tobacco, trying to always wear your seatbelt, wear your helmet, don't use alcohol excessively. All of those things really are building blocks to long-term health.
Wonderful. Such great advice, and we're taking care of moms out there, making sure they are healthy. More questions? We'll just call that number on your screen. It's 866-637-5268. Optum Care Utah is a great resource, and we'll, of course, have a link on our website. Thank you so much.
Absolutely. Thank you for having me.
All right, staying on the topic